During the COVID-19 pandemic, much work has gone into digitising and moving services remotely, and patient attitudes to telemedicine have changed dramatically. This may not outlast the pandemic, and this study sought to view if telephone clinic follow-ups are a viable long-term option after routine elective hand surgery. It is well known that telemedicine serves many roles in modern orthopaedics and is established in many centres for fracture clinics and in certain elective settings. We also know that patients are generally able to provide accurate assessments and examinations over the phone. However, there has been no direct work evaluating a comparison between face-to-face and telephone clinics for immediate post-operative assessment, and especially not in day case hand surgery. This study compared a retrospective cohort of 64 patients who were followed up in the normal face-to-face clinics and a prospective cohort of 61 patients who were followed up by a specialist hand therapist over the telephone. This was conducted prior to the COVID-19 pandemic. Patients were asked questions about how they perceived the ability of the clinician to assess their post-operative progress, whether they felt they were able to communicate their concerns and ask questions, how convenient the appointment was, and their overall satisfaction with the appointment. They were also asked whether they would recommend that type of follow-up to their friends and family if they were undergoing a similar operation, and if they would prefer to have that method of follow-up again if they were to undergo the same operation. We found significant differences across every domain. Patients gave significantly higher average scores to telephone follow-up in all domains. They found it was easy for them to raise questions, and they felt the clinician was adequately able to assess their progress. It was much more convenient, and they definitely preferred telephone clinics to the face-to-face clinics overall. They were more likely to recommend telephone clinics to a friend if they were going to undergo a similar procedure. Further to this, 70% of the face-to-face cohort said that they would prefer to be followed up over the telephone if they were to have the operation again. As well, 86.5% of the telephone follow-up patients would prefer to have telephone follow-up again if they came back. This increase narrowly misses statistical significance, but it does hint that exposure to telephone clinics enhances patient comfort with the process, rather than turning them off it. In conclusion, we found that patients significantly prefer telephone follow-up for day case hand surgery and feel that it provides adequate assessment of their post-operative process, is much more convenient, and is overall a better experience for the patients. As the follow-up was before COVID, we believe that this sentiment predates COVID and therefore is likely to continue past the cessation of COVID-19 restrictions. There are significant cost benefits to moving services to the telephone, and so we would recommend and suggest that other centres either continue any service similar that they have running or consider starting up such a clinic.